school.
Let's head right into what you just said, the new isolation rules. 5 days, and then if you can present a positive test after 5 days, you come out of quarantine. If it's still positive, you stay for the 10 days. That's brand new. And do you think this is going to help?
It's a mix, as we all saw with the flight cancellations, all the staffing shortages. I mean, when 1 million people a day are getting infected, you've got 1 million people out of work, and that just keeps building. What the CDC said here, and I think it's a real move, is we're moving away from COVID zero. We're starting to say, in times of crisis, staffing crisis, we've got to have a balance here. And a lot of people are upset with these changes. And to be honest, the CDC has said, yeah, we look at people at day 6, and a third of them are probably still infectious, not as infectious as they were in the first few days of the illness. So they have come out very clearly. People are the most contagious, the most infectious 1 to 2 days before symptom onset, and for probably 2 to 3 days afterwards. So this is pretty aggressive. Not everyone has jumped on board with this. I know our organization has said, we really want a negative test, which is not part of the CDC guidelines, at day 6 or 7 before you come back. If you wait a little longer, okay. These are really ways to deal with a crisis, a staffing shortage. And, we look at it in healthcare. If you're not there to take care of patients, that's a very dangerous situation. But the schools, that's going to be school by school, state by state. Do you really want to send kids back who are still infectious? Are there ways to still do like temporary virtual learning? So I think we're all going to have to struggle with this situation.
Right, and teachers not wanting to reinfect people going back too soon, but then there's those staffing shortages, and let's teach our kids. So it's kind of like either way you go, you're stuck.
It is a challenge, because I thought it was interesting that we were prioritizing, the workforce, but then somehow saying the schools, you need to stay out longer, when we've actually learned that schools can be a pretty safe situation for our kids. So, yeah, this is a challenge. Nobody wants to go into the workplace. No one wants to go into the school and infect others. But at the same time, as we've seen, there's been a lot of really negative impacts on our kids, learning issues, mental health issues with all the isolation. Once children have been vaccinated, their risk is getting to be incredibly small. So there's a certain balance, because it's not without risk to keep them home. It's not without risk to fail to educate, fail to have those social interactions.
All right, this topic is